Prolactin is involved in milk production. It is produced by lactotrophs and interior pituitary. Factors that increases prolactin production. Estrogen stimulates prolactin production. Pregnancy and oral contraceptive pills also increases prolactin production. Let us discuss how hypothyroidism causes increased prolactin production. As we all know, there is low level of T3 and T4 in hypothyroidism, which stimulates the release of thyrotropin releasing hormone from hypothalamus. Thyrotropin releasing hormone stimulates thyrotropes and interior pituitary to secrete TSH. Thyrotropin releasing hormone also acts on lactotropes and interior pituitary to stimulate increased prolactin production. That is why we see increased prolactin production in hypothyroidism. Dopamine decreases prolactin production. On the other hand, dopamine antagonist increases prolactin production. Causes of increased level of prolactin in blood. Physiological causes include breastfeeding, pregnancy, stress, and nipple stimulation. On the other hand, pathological causes include prolactinoma, use of dopamine antagonist, hypothyroidism, chest wall injury, and chronic kidney disease. In chronic kidney disease, there is decreased excretion of prolactin. That is why we see increased level of prolactin in blood. Prolactinoma. It is most common pituitary adenoma. It is characterized by increased serum prolactin level. Prolactin inhibits pulsatile gonadotropin releasing hormone release from hypothalamus, resulting in decreased LH and FSH secretion from interior pituitary. Low LH and FSH from interior pituitary results in decreased estrogen level. Low estrogen level increases osteoclast activity, which are bone dissolving cells, resulting in bone loss and increasing the risk of fracture. Low estrogen causes thinning of vaginal epithelium and decreased vaginal secretion, resulting in vaginal dryness and painful sexual intercourse. Low LH and FSH inhibits ovulation, increasing the risk of infertility. Premenopausal women with prolactinoma will present with features of amenorrhea, infertility, galactorrhea, hot flashes, and decreased bone density. Decreased LH level in men decreases testosterone production by Leydig cells, so patient will present with features of decreased libido, erectile dysfunction, decreased secondary sexual character, infertility, and impotence. Pituitary gland is located directly below optic chiasm. It grows upward from sella turcica, can compress optic chiasms, resulting in loss of peripheral vision in both eyes and headache. Read this question stem. 28-year-old woman, low T3 T4 with elevated TSH. Patient reports cold intolerance, dry skin, weight gain. As we all know, this patient has primary hypothyroidism. In primary hypothyroidism, low T3 T4 stimulates the release of thyrotropin releasing hormone from hypothalamus. Thyrotropin releasing hormone acts on thyrotropes on interior pituitary to secrete thyroid stimulating hormone. Thyrotropin releasing hormone also acts on lactotropes to stimulate the secretion of prolactin from interior pituitary. That is why this woman has galactorrhea and elevated prolactin level due to primary hypothyroidism. Read this question stem. 25-year-old woman has history of amenorrhea and galactorrhea. She has high serum prolactin level. Pregnancy test is negative. Cells involved in this patient conditions. As we all know, prolactin is produced by pituitary lactotropes. Dopamine acts on D2 receptor on pituitary lactotropes and inhibit the release of prolactin from pituitary lactotropes. So, dopamine is responsible for tonic inhibition of lactotrophs involved in this patient condition with high prolactin level. Why do we see amenorrhea in patient with high prolactin level? As we all know, prolactin is produced by anterior pituitary cells. It inhibits the release of gonadotropin, releasing hormone from hypothalamus, resulting in decreased LH and FS secretion from anterior pituitary. Low level of FSH and LH results in amenorrhea and increases the risk of infertility in premenopausal women. Read this question stem. 30-year-old woman with known history of prolactin secreting pituitary microadenoma complains of persistent bone pain with low T score. Which of the following is most likely mechanism of her bone loss? As we all know, prolactin is produced by anterior pituitary cells. Prolactin inhibits the release of gonadotropin, releasing hormone from hypothalamus, resulting in decreased secretion of FSH and LH from anterior pituitary cells. Low FSH and LH results in low estrogen level. Low estrogen level stimulates the osteoclast cells, which are bone dissolving cells, resulting in loss of bone and increased risk of fracture. Read this question stem. 29-year-old woman with 6-month history of milky nipple discharge and difficulty in conceiving. Menstrual cycle is infrequent and light. She has bilateral Galactorrhea. Serum prolactin level is high with low LH and FS. What is the reason behind amenorrhea and increased risk of future fracture in this patient? As we all know, this patient has prolactinoma. Increased level of prolactin inhibit the release of gonadotropin, releasing hormone from hypothalamus, resulting in decreased LH and FSH secretion from anterior pituitary. Low LH and FSH means low estrogen level. Estrogen level Low estrogen level stimulates the osteoclast cells, resulting in bone loss and increased risk of fracture. Low LH and low FSH also increases the risk of amenorrhea and infertility in patients with. Read this question stem. 34-year-old woman is evaluated for 1 year history of headache and bilateral nipple discharge. She has amenorrhea with high serum prolactin level with negative pregnancy test. MRI shows pituitary mass. She has reduced bone density on DEXA scan. A patient with headache, galactorrhea, amenorrhea with high serum prolactin level, pituitary mass and MRI. This is prolactinoma. High prolactin level inhibits the release of gonadotropin, releasing hormone from hypothalamus, resulting in decreased LH and FSH from anterior pituitary. Low LH and FSH means low estrogen level. Low estrogen contributes to bone loss and increased risk of fracture. It also causes vaginal epithelium thinning and decreased vaginal secretion, resulting in painful sexual intercourse. Read this question stem. 26-year-old woman presents with secondary amenorrhea and bilateral galactorrhea. She has high serum prolactin level. As we all know, this patient has prolactinoma. Prolactin is produced by lactotrophs in interior pituitary. Cells in interior pituitary such as somatotrophs, gonadotrophs, lactotrophs are derived from ectoderm, while cells in posterior pituitary are derived from neuroectoderm. Read this question stem. 31-year-old woman has history of secondary amenorrhea and milky nipple discharge. She has unable to conceive for 18 months. Physical examination shows decreased peripheral vision. MRI of brain shows mass within cilia turcica that is compressing the optic chiasm. Decreased peripheral vision is due to mass compressing the optic chiasm. Women secondary amenorrhea, galactorrhea, unable to conceive with mass and pituitary. This is most likely prolactinoma. As we all know, prolactin is produced by lactotrophs in interior pituitary. Cells in interior pituitary such as somatotrophs, gonadotrophs, lactotrophs are derived from surface ectoderm, while the cells in posterior pituitary are derived from neuroectoderm. Read this question stem. 32-year-old woman, history of irregular menstrual cycle, milky discharge from breast, unable to conceive. Physical examination shows galactorrhea. A lab shows high serum prolactin level. MRI of brain reveals mass and interior pituitary. This patient has prolactinoma. Patient initiates treatment with a medication intended to shrink the lesion and restore ovulation. As we all know, dopamine agonists are used in the treatment of prolactinoma. Dopamine acts on D2 receptor on pituitary lactotrophs, resulting in decreased secretion of prolactin from lactotrophs and restoration of gonadal function. Read this question stem. 38-year-old male has history of headache, persistent fatigue, decreased peripheral vision, significant decrease in morning erections and overall sexual desire. Physical exam shows galactorrhea and loss of vision in both eyes. Lab shows high serum prolactin level. MRI confirms pituitary mass. Headache and decreased peripheral vision in this patient is due to pituitary mass compressing the optic chiasm. High prolactin level in this patient decreases the release of gonadotroph releasing hormone from hypothalamus, resulting in decreased LH and FSH. Decreased LH decreases the release of testosterone from Leydig cells. Thus, this patient has decreased libido, morning erection. Medical treatment of prolactinoma involves dopamine agonists such as bromocriptine. It acts on D2 receptor on pituitary lactotrophs, resulting in inhibition of prolactin secretion. It improves the level of SH, LH, testosterone, improves libido, and reduces the size of tumor. Read this question stem. 34-year-old man presents with 6-month history of blurry vision, decreased interest in sexual activity. MRI shows pituitary mass. Pituitary mass, high serum prolactin with symptoms of decreased peripheral vision and headache and decreased gonadal function. It is prolactinoma. As we all know, prolactin inhibits the release of gonadotroph releasing hormone from hypothalamus, resulting in decreased level of LH and FSH. Decreased LH decreases the testosterone secretion from Leydig cells. Read this question stem. 41-year-old man has history of decreased peripheral vision, decreased libido, and difficulty in maintaining erection. It is prolactinoma. Prolactin inhibits the release of gonadotroph releasing hormone from hypothalamus, resulting in decreased level of LH and FSH. Decreased LH decreases the testosterone release from Leydig cells. Read this question stem. 41-year-old man, history of decreased libido and difficulty in maintaining erection. He has history of decreased peripheral vision. Physical examination shows bitemporal hemianopsia and bilateral decreased testicular volume. Serum prolactin level is high. MRI shows cellular mass compressing the optic chiasm. Mass compressing the optic chiasm results in bitemporal hemianopsia, which is decreased peripheral vision. Pituitary mass with high serum prolactin level with symptoms of decreased peripheral vision, headache, and decreased gonadal function. It is prolactinoma. As we all know, prolactin decreases the secretion of gonadotroph releasing hormone from hypothalamus, resulting in decreased LH and FSH. Decreased LH results in decreased testosterone release from Leydig cells. Low testosterone level results in decreased libido and difficulty in maintaining erection. Read this question stem. Patient with pituitary adenoma complains of loss of peripheral vision. Which of the following structure is being compressed by tumor to cause this symptom? Optic chiasm suppression by pituitary adenoma results in bitemporal hemianopsia, which is decreased in peripheral vision.